Madam President, with less than 2 weeks remaining from the deadline for people who need to sign up for health insurance that starts for them to be insured for January 1st, there's a significant amount of anger as well as anxiety across the country. The website where people are supposed to go to buy that insurance has been plagued with problems that everyone in the country seems to know about. And that has caused huge amounts of anxiety. I heard about it last week in Wyoming. I hear about it on Capitol Hill with staff members, and I hear it pretty much anywhere I go. What people have been learning is that the problems with the website is just actually the tip of the iceberg. The Obama administration has been saying that it's been fixed, that the problems with this health law are fine, that everything is good, that a majority of people are having good experiences. I remember listening to the president not long ago, sitting with Bill Clinton, saying easier to use than Amazon. Well, that's not what the American people found. He also said cheaper than your cell phone bill. He said you'll be able to keep your doctor if you like it. But the law continues to leave so many Americans struggling with higher costs, with greater confusion, and really with a lot less confidence in the administration. People all around the country are worrying if the administration even knows what it's doing. So when I talk about the website being just the tip of the iceberg, people around the country are running into higher premiums, canceled coverage, finding out that they can't keep their doctor. They're running into fraud and identity theft issues and higher issues in terms of higher copays and out-of-pocket costs and deductibles. People at home in Wyoming, and I went not just around communities in the state and traveled to a number of different communities, but also went to my own medical office, where I practiced as an orthopedic surgeon at Casper Orthopedics for 24 years. And people were telling me how worried they were about the higher costs that they're seeing regarding paying for insurance for next year. I got a letter from one man in Cody, Wyoming. He talked about the rates that he's been quoted are going to go up from about $860 a month that he pays now. He's a family of four, to $2,400 a month, $860 to $2,400 a month. He said, I'm not sure what planet they think I live on, he said, but there is no way I can spend more than half of my monthly income on insurance. Well, I hear the same thing from people all around Wyoming. People are having the same sticker shock all over the country. Now, we know that more than 4.7 million Americans, 32 different states, are being told that they can't keep the insurance that they had. And when you take a look at the map, Madam President, you know, we don't have the numbers yet on certain numbers of the states, and, including the state of Wisconsin. We don't have Illinois. We don't have Ohio. We don't have Texas. We don't have Virginia. So we really don't know how many people have lost their coverage, but we know at least 4.7 million Americans were told that they can't keep the insurance they had, in spite of what the president may have promised them. Well, now what they have to do is buy new Washington-approved health coverage that really may not be the right coverage for them and may likely cost more than they were paying before. Millions of Americans are going to be forced to use money that in the past used to pay rent or to put their children through school or to invest in their communities or in a business to help make repairs of the house. And now that money is going to go to pay for higher premiums as well as the incredible high deductibles that people are seeing related to the health care law. It's, it's interesting looking through the papers. This was yesterday's Wall Street Journal, Monday, December 9th, above the fold, right here, front page, deductibles fuel new worries of health law sticker shock. The article says that the average individual deductible for what is called a bronze plan on the exchange, that's, of course, the lower priced coverage, it's $5,081 a year, according to a new report on insurance offerings in 34 of the 36 states that rely on that federally run online market. Well, this is 42% higher, the Wall Street Journal reports, than the average deductible of over $3,500 for an individual who purchased plan in 2013, which is, of course, before much of the federal law took place. So what people are seeing, and the Wall Street Journal reports there above the fold on the first page, is higher deductibles by a lot. And it's not just the Wall Street Journal, the New York Times. Yesterday, Robert Pear's article on health exchanges, premiums may be low, but other costs can be high. It says as consumers dig into the details, something this body never did. Members of that part of the body who voted for this health care law never did dig into the details. It says as consumers dig into the details, they're finding that the deductibles and other out-of-pocket costs are often much higher than what is typical in employer-sponsored health plans, the plans that many of these people have had in the past. So what we're seeing is not just the higher costs, not just the higher deductibles, the higher copays. There's also a lot of confusion about the health care website itself, and that's, I think, only going to get worse. 10 weeks after the website launched, there's still an awful lot that's broken, including the parts that actually get people the insurance that they think they signed up for. A number of my staff have applied, and they believe they've signed up for health insurance. They're not sure. They haven't yet gotten confirmation, and I know that members on Capitol Hill who have staff signing up are experiencing that same thing. Last month, one of the officials from the Department of Health and Human Services testified in the House of Representatives that as much as 40% of this website system still hasn't even been built yet. The website still has trouble transmitting information to the insurance companies once someone has chosen a plan. The website was down again earlier today. Still hasn't figured out how to automatically pay the portion of premiums covered by government subsidy. There are still many, many security holes that can be exploited by con artists, by hackers. Certain branches of the government have been warning citizens to be cautious when going on the website because of the concerns about exploitation of people who are trying to use these in a fraudulent way. And then you hear the administration who is bragging. I mean, it's really sad that almost 9 weeks after the website opened, the administration is now bragging that it only has an error rate of 10% on one important step of the website. 1 in 10 is their error rate. This is a president who said that the website was going to be running like Amazon.com. He said that 3 or 4 days before the website opened. Now, 9 weeks later, he's delighted that the error rate is still 1 out of 10. Does the president actually believe that Amazon would accept a 10% error rate in their customers not being able to finish their purchase? All of these flaws and failures have led to a dramatic loss, I believe, of confidence by the American people in their government. And according to a new Gallup poll, 52% of Americans are in favor of scaling back the health care law or repealing it entirely. People continue to turn against the law for a number of reasons, and it's not the website, it's the higher premiums, it's canceled coverage, it's can't keep their doctor, fraud and identity theft, higher copays, higher deductibles, and confusion about what's going to go wrong next, because so many things that the president and his administration have said, have looked into the camera, told the American people would be one way, turned out to be something very different. There have just been so many changing stories coming out of the White House. The president said if you like your health insurance, you could keep your health insurance. And then he actually said period, like a punctuation mark, that was it. No ifs, ands, or buts, just the period. And people now know all across the country, those who voted for him, those who didn't, what they all know is what the president said wasn't true. The president said if you like your doctor, you can keep your doctor. Well, on Sunday, one of the architects of Obamacare went on Fox News and admitted also that that wasn't true. This is Dr. Ezekiel Emanuel, brother of Rahm Emanuel, the former chief of staff of the White House, is a medicine professor. And what he said is if you like your doctor and you want to keep your doctor, you can pay more for insurance that includes your doctor. A lot of places, you can't even buy insurance that will cover that doctor. This isn't at all what the president promised. And it's interesting, in even the paper, the Financial Times, yesterday, healthcare insurers cut costs by excluding top hospitals. So you can't even go to the hospitals. There's a picture here of MD Anderson Cancer Center from the University of Texas. Plan will not cover treatment at Houston Cancer Center. Well, so if we have somebody who's lost their insurance, who's been going to that cancer center where their doctors are, and they're losing their insurance on January 1st, not only can't keep your doctor, you can't keep your hospital. We see children's hospitals around the country, people that are not going to be included in these exchanges. So children with leukemia come January 1st, losing their doctor, losing their hospital. But that's what the president and that's what the Democrats in this body who voted for this health care law have given to the American people. You know, just before Thanksgiving, the Obama administration announced that it would have to delay a health insurance exchange that was supposed to let small businesses shop for insurance. I remember hearing speeches on this floor about small businesses and being able to find affordable insurance. Well, it turns out, once again, the administration knew at least 6 weeks before that they were going to have to delay the program. Did they admit it to the American people? Did they tell the truth? No. They waited. One broken promise after another, one statement after another, the administration knows is not true. So is it a surprise then that the President of the United States is viewed as untruthful by a majority of the people of this country? It's a terrible situation for anyone to put their country in. You know, back when we first started talking about the health care law, Republicans offered ideas for how to give people what they really wanted, which was reform that lowered costs and improved access to care. That's what people were concerned about. So many of the complaints we've heard around the country had to do with the cost of care. So President Obama and Democrats in Congress refused to listen, ignored all the warning signs, used raw majority power to force this bad law on all the American people. I remember the vote in this body, Christmas Eve morning, voting on a health care law, watched it cram through party line votes, and now Democrats in the Senate decided to make another power play and broke the rules of the Senate just this couple of weeks ago to change the rules of the Senate. They took a drastic and unwarranted step so that they can have the power once again to force more bad ideas like the Obama health care law onto the American people. They say, we don't need the 60 votes now. All we need is a simple majority. Let's change the way that the Senate has run for well over 100 years. Because, once again, the Democrats say, we know better than the American people. We know better than you. It's what the president said with his health care law. And now the American people are realizing, well, what they knew all along. This isn't what they wanted with health care reform. Regrettably, it's what they're living with now and are seeing: the higher premiums, the canceled coverage, losing their doctor, the fraud and identity theft, higher copays, higher deductibles. And it's interesting, even today in the Washington Post, front page, above the fold, under health law, insurers limiting drug coverage, costs may soar. And it talks about for many different ailments, including for those with HIV. That's a result of the health care law. If this health care law would not have been passed, forced down the throats of the American people, with the president telling one falsehood after another, deliberately designed to mislead the American people, you would never have seen a headline like this today. If President Obama really wants to help the American people, he's going to sit down with Republicans and talk about the real issues to reduce costs, to get rid of all of this confusion that he and the Democrats have caused, and to restore people's confidence in America as well as in him. There's a better way. Republicans agree we need to reform America's health care system. We think that those reforms could have been done without the kind of harm caused by the president's health care law. Thank you, Mr. President. I yield the floor.